Hello and welcome to Medical Dialogues. I'm Roshni. Let's look at today's top medical highlights. Defective closure of diabetic foot ulcers associated with higher risk of wound recurrence. Results from a new study of diabetic foot ulcers and the risk of wound recurrence show that a new approach can help healthcare workers measure the likelihood that the wound will reopen in the future. Researchers say these findings are likely to lead to further studies aimed at decreasing amputation rates for the tens of millions of people with diabetes in the US. Researchers said diabetic foot ulcers develop in diabetic patients with diabetic neuropathy, a condition which causes numbness in the foot. They also said the nerves in the skin become dysfunctional, which can cause patients to injure the affected foot without feeling it. Those untreated wounds can lead to infections, and if an infection is not treated quickly, an amputation may be necessary. It is the first consortium for the diabetic foot ulcers in the US. Researchers found those with a high TEWL, signifying poor skin barrier function, had twice in the incidence of wound recurrence compared to those with a low TEWL reading. In addition, participants' self-reported recurrence was highly concordant with clinician assessment of wound recurrence. Although TEWL was not validated as a biomarker in the study, findings of the study are an important advancement in that direction. Researchers said wound recurrence is a major healthcare cost burden, but this method of measuring TEWL is easy for healthcare providers to use with just 30 minutes of training. They said this is a transformative scientific discovery that will help further efforts to validate the biomarker and therefore improve the quality of life of patients with diabetes. We look forward to future studies of this method that will ultimately lead to new clinical practices to help patients all over the world. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.